Welcome back to TV5 News at 9. It is time now for Aging in Style with McLaren. Joining us this morning is Dr. Michael Abdul-Malek. Thank you so much for being here today.
Thank you.
And I understand you are new to McLaren. Welcome.
Yes, thank you.
We're so excited that you're right in our neighborhood now. We are talking today, doctor, about AFib. Tell us, what is AFib?
Atrial fibrillation is the most common abnormal cardiac rhythm. It is a fast, complex, and chaotic type of rhythm affecting the upper chambers known as the atria. During atrial fibrillation, the chambers of the heart, the top chambers of the heart, are not contracting normally. At first they quiver, then they get to a mechanical standstill. The lower chambers of the heart also can beat in an irregular way and a fast heart rate. The atrioventricular node is the filter, if you will, in the electrical conduction system that the ventricles begin beating at a rate of about 100 to 200 beats per minute.
Wow. So, doctor, if someone feels these symptoms, is it important for them to seek care, and why immediately?
Absolutely. Because the upper chambers are not contracting normally, the blood pools in the upper chambers of the heart and can cause a clot, which we call a thrombus. If that clot dislodges, it can go to the brain and cause a stroke. The American Heart Association estimates that from the 700,000 strokes that occur each year in the U.S., about 15% of them are in patients with atrial fibrillation. Apart from the major side effect, it can result in symptoms that can cause a fair amount of morbidity.
Wow, that's an alarming stat, doctor. Now tell me this, if someone has had these symptoms and they've had AFib for years without any side effects, does it really need to be treated?
People with atrial fibrillation can live with the condition for many years, but they should not consider this disease to be benign. Complications associated with atrial fibrillation can be life-threatening. Atrial fibrillation may reduce the pumping efficiency of the heart, creating a 5-fold increase in the risk of stroke and can double the risk of mortality.
Wow, doctor, so what are some of the risk factors, would you say, for developing AFib?
So that's very important.
Yeah.
The risk factors for atrial fibrillation can be cardiac-related versus non-cardiac-related risk factors. The cardiac-related risk factors include pre-existing heart disease, valvular heart disease, hypertension, which is high blood pressure, coronary artery disease, congestive heart failure, diabetes, and we can also see atrial fibrillation after cardiac surgery. The non-cardiac related risk factors also can be extreme stress, drugs, illegal drugs, significant amounts of caffeine can be associated with atrial fibrillation. Alcohol and binge drinking can be associated with atrial fibrillation, and some medications can also cause atrial fibrillation. There are diseases that we keep in mind as well, such as hyperthyroidism, which is an overactive thyroid, or we see sometimes atrial fibrillation with severe infections. Sleep apnea is very important, and as well as atrial fibrillation can also be idiopathic, which means that there's no known cause.
Now, doctor, if someone has these symptoms and they're saying, oh my goodness, I think I have AFib, what are the treatment options that are out there for them?
Well, the treatment options can include antiarrhythmic medications in conjunction with blood thinners. And it is important to remember that a patient with atrial fibrillation does not always remain in atrial fibrillation. Atrial fibrillation can occur, and when the patient is in the ER, their EKG may show normal rhythm. So sometimes we may use antiarrhythmic medications, and the blood thinners are different for different patients. Some patients with valvular heart disease, such as severe mitral stenosis or mechanical valves, may need to be on certain blood thinners. There's also electrical cardioversion that we can use to temporarily correct this condition, and sometimes We can also use catheter ablation in certain cases, which is an invasive procedure that electrophysiologists do to try to correct atrial fibrillation.
Sure. Now, doctor, if someone wants more information, do you have some upcoming community events that they should be aware of?
This Thursday, I will be holding a Facebook Live event identifying and treating atrial fibrillation on the McLaren Bay Region Facebook page at 5 p.m. I would love to answer everybody's questions in real time as the presentation wraps up. We will also be hosting a special heart health and stroke screening event on June 30th. Pre-registration is required. You can visit mclaren.org/hearthealth for more information.
Doctor, is there anything lastly that you'd like to reiterate or just make sure people know about AFib?
Atrial fibrillation it's very important to realize that the stroke associated with atrial fibrillation can sometimes be a mini stroke or it can be a disabling stroke. Unfortunately, we cannot use a medication that gives us 100% benefit with 0% risk. And so what I tell my patients is that the important thing to remember is that when we use blood thinners, we have to make sure that the benefit of the medications that we're using outweighs the risks.
That's great information. Doctor, thank you again for joining us this morning. And again, welcome to Mid-Michigan and to McLaren. We appreciate you.
Thank you for having me.
Of course, you're welcome. If you'd like any more information, just head on over to the Aging and Style page. That's at WNEM.com.